Welcome to knowledge demo. So today I am going to explain about the specialty fabrication for maxillary and mandibular complete denture. So to start the fabrication, first we have to draw the lines in the primary cast for adaptation of the wax spacer, followed by the fabrication of the special tray. Okay. So what I am going to do now is, first I am going to use this Boucher's spacer design for this fabrication of the special tray. So this is the primary cast made from the diagnostic impression, or that is the primary impression. So I am going to draw the three lines. One is the depth of sulcus, this first line is depth of sulcus. I think you can able to visualize here. This is the first line. It is a depth of sulcus. I am highlighting this line. The first line is called depth of sulcus. And second line, what I am going to draw is the tray extension. That is 2 mm from the depth of sulcus. So you will be thinking why it is 2 mm short from the depth of sulcus. The logic behind this is, see, you have made the primary impression and now you are going to make the custom tray for this particular clinical case. So you are going to record the borders, that is the peripheral borders, accurately. So in order to record the borders, we have to provide space for the material, for the low fusing material what we are going to use for border molding. We have to provide some space. So from this is the depth of sulcus what we record in the primary impression. So from this we are giving 2 mm short, that is for the space for the low fusing compound to be added and molded the final secondary border. So this has to be 2 mm short. So if you notice here, I am making a U-shaped depression in the frenum area. Why? Because it has to be not in a straight line. It has to follow the anatomical curvature of the particular area. For example, in frenum you have to give a V-shaped relief for this tray line, and also in the buccal frenum you have to give a double relief because it is a 2 frenum in this attachment, in this area. So I am drawing 2 mm short. Okay. So now I am going to highlight this second line what I draw. So this is the tray line. This will be 2 mm short. So far have drawn 2 lines. I think you can able to visualize it. One is the depth of sulcus, the bottommost line is the depth of sulcus, and 2 mm short is the tray line. Now I am going to draw the third line, that is the spacer line. So that will be 2 mm from the proposed tray line. So it will be almost 4 mm short from the depth of sulcus. If you notice here, this spacer line will be 4 mm short from the depth of sulcus. So it has to follow the outline of the tray line. Again you have to give a V-shape design in the frenum area to accommodate the frenum. So far I have drawn in the sulcus region. So now I am going to complete in the posterior palatal region. So if you closely watch here, the stray line mainly I am going to extend into the posterior border, that is the PPS area. It will be coinciding from to the hammer notch to hammer notch. The stray has to be extended till this posterior vibrating line. So the reference point will be the hammer notch to hammer notch. If you notice here, this stray line I am extending in the posterior aspect, that is the extension of the tray in the posterior aspect till the posterior vibrating line, that is the reference from hammer notch to the hammer notch on the other side. So this will form the posterior line, that is a posterior extension for the tray. So the next line will be the spacer line that has to coincide to the anterior vibrating line, that is we are drawing tentatively. Why? Because in this Boucher design he has recommended that we have to cover the spacer, that is a base plate wax of 1 mm thickness onto the entire denture base area, but only exposing the posterior vibrating line. Now you can clearly notice this. Have extended the anterior vibrating line, that is a spacer extension correlating to the anterior vibrating line. Why? Because as per Boucher state recommendation, we have to expose the posterior palatal C area. So that will act as a guiding stop for the positioning of the tray. So in addition to this, we are using the stopper in this design. Why? Because to provide the extra support for the tray to prevent the vertical displacement of the tray during impression making. So I will be drawing this stopper in the canine region bilaterally. So using the CPC, that is a incisive papilla canine prominence. So this reference you can locate the canine region. So here you can draw the stopper of 2 mm 2 into 2 dimension, 2 mm into 2 mm dimension stopper in the canine region, and 2 more stoppers in the first molar region. The functions of the stopper are, it's going to prevent the vertical displacement of the tray, and also it provides the uniform thickness for the impression material to flow during impression making. Now you can see there is a 2 stopper in the canine region bilaterally, one on this side and one on the other side, and same way this 2 more stoppers in the first molar region. So this is the design outline for the maxillary cast. So now we are going to see for the mandibular cast. So this is the primary cast made from the primary impression. So here we are going to see, first we have to highlight the depth of sulcus as we did for the maxillary cast. We are going to do for here in the mandibular cast. In the lingual aspect, you have to first highlight this depth of sulcus. We are covering on the retromolar pad area and extending onto the buccal sulcus, buccal frenum, labial sulcus, labial frenum. As I mentioned, you have to follow the anatomical ups and downs. There is a frenum relief, all those things you have to follow in this depth of sulcus outline. Now you can visualize that we have first marked the depth of sulcus line. Okay, is it clear? Have marked the entire region, both lingual and buccal aspect. Have first marked the depth of sulcus outline, and next I am going to draw the trach extension line. So as I mentioned, it will be 2 mm short from the depth of sulcus. So in the lingual region, I have drawn this second line. Now you can able to visualize it. It will be 2 mm short from the depth of sulcus. So I am going to continue this second line to the labial aspect and the buccal aspect. I am continuing on the buccal and labial, same way for this this side also. It's 2 mm short. So we have drawn 2 lines. Now you can see the lingual aspect and also in the labial and buccal aspect. That is, first one is depth of sulcus and second will be the trail line. This is a proposed trail line for this case. So third, we are going to draw the spacer outline. Similarly, this has to be 2 mm short from the tray outline, proposed tray outline, and it will be 4 mm short from the depth of sulcus. So I have completed for the lingual side. So now I am going to extend for the labial aspect. So here only variation is we are following the Boucher's spacer design now. So we are going to expose the buccal shelf area in this spacer outline. Why? Because that will be as the primary size bearing area, as we know. So we are going to expose this buccal shelf area in the spacer outline. As I mentioned, this Boucher's design is a selective pressure technique. So we are relieving the biomechanically sound structures and covering the vulnerable tissues. So by which we are going to apply selective pressure onto the denture bearing surface during the secondary impression. If you closely watch, we are not covered the buccal shelf area. So as I mentioned, for the mapper, this buccal shelf area will act as a stopper for the tray during impression making, and if we desire, we can add 2 more stopper in the canine region for the extra vertical support. So in the canine region, we can add two stopper. That is 2 into 2 diameter, 2 into 2 millimeter dimension stopper in the canine region. Okay, so by this we are completing the spacer design outline for the maxillary mandibular cast. Three lines, and each will be 2 mm short, and you are exposing the buccal shelf area and stopper in the canine region. Now in this video we are going to see the application of cold mold seal in the primary cast before making the custom tray. So it is advised to apply this cold mold seal in unidirectional way to prevent the removal of the first applied layer. So the mechanism behind this cold mold seal is a sodium alginate composition. So if it comes in contact with the calcium sulfate, it forms a calcium alginate and it sets on the cast surface to form a impermeable thin layer. So that will act as a separating medium for the acrylic to not to bond on the cast surface. Similarly, we have to apply for the mandible also. Now cold mold seal applied was dry. So now we are going to adapt the wax sheet onto the cast. So you have to take a sheet of base plate wax and you have to heat it gently. You should not melt, only you have to soften the wax. Once it becomes softened, it will sag, and now you can see the sagging of this wax. So at this time you have to apply on this cast and you have to adapt it onto the ridges of the axillary cast. By adapting onto the cast, you can able to visualize the black line which was drawn on the cast. So using that as a reference, you can cut the excess wax. You can limit the wax extension up to the desired spacer outline which was drawn on the cast. Similarly, you have to do for the mandible also. So I am going to first remove the excess. After removing the gross excess, so I am going to readapt this wax. If required, just you can flame it and then you can re-adapt the borders. After re-adapting, if you closely watch here, you can see the extension line what we drawn for the spacer through the wax. So using that as a reference, you can remove the excess wax beyond the spacer outline. Now you can see in this area, the first line is the depth of sulcus, second line is the tray, and then third line what we drawn is for spacer outline. So still I can see there is some excess of wax beyond the tray outline, so I am going to remove the excess. Now you can see here, we have removed the wax beyond the line what we drawn, so it's exposing the posterior palatal seal area. Now you can see clearly there is a 2 mm short from the tray outline, that is from the second line it is 2 mm short. So like this you have to remove the excess wax. So now the wax has been adapted up to the proposed spacer line. So in addition to it, we are going to incorporate the stopper, that is 2 mm into 2 mm dimension, that is one in the canine region on both sides. The canine region, and one in the molar region on both sides, first molar region. So 4 stoppers is the final after adapting the base plate blacks. Similarly, you have to do for the mandibular arch. Now we are going to see about the spring-clone method for special tray fabrication. So here we have first finished the outline, and then we applied the cold mold seal, and then we have adapted the base plate wax, and then we have made the cut up to the desired spacer line. So this is about the Boucher's design, selective pressure technique. So now we are going to do the acrylic special tray fabrication. So we are going to use this spring-clone method. So first what you have to do, first you have to sprinkle the powder. There is a acrylic, there is a cold cure acrylic powder, that is methyl methacrylate. So I have applied a thin layer of Vaseline on this wax surface. Why? Because it allows the easy retrieval of the wax spacer during the final impression. So after I added the powder on the surface, I will be keeping it in a particular angulation so that this powder will not flow from the desired position. So once the powder has been added, we have to drop the liquid on the powder. So you have to drop the monomer in a controlled manner so that it should not flow away from the surface. So the desired thickness for this special tray will be 2 mm. So once you have dropped the liquid, then you can add the monomer side by side. So while adding on the stopper region, you have to make sure that it has to flow properly into the stopper region. Why? Because if there is any chance of air bubble entrapment in that region, it will cause the voids in the stopper. So the purpose of the stopper will not be fulfilled. I am adding in a increment basis. So to control the thickness of this special tray, so I am adding in a increment, not in a bulk. So after sprinkling the powder, so I am dropping the liquid again. I am still maintaining this portion of the cast in such a way it should not cause flowing of the acrylic resin from the desired position. So you have to allow certain amount of time for it to polymerize and to set on the particular location. So once it sets, then you can alter the position of the cast, and then you can add incrementally onto the entire surface of the desired tray outline. So if it excess acrylic resin is flowing away from the proposed tray outline, you can remove the excess and you can readapt the excess onto the deficient area. So like this you have to add incrementally and you have to fabricate the custom tray. In order to prevent the porosity on the surface of this special tray, we have to do one technique. We can cover this surface with a cast with the bowl. Why? Because the monomer is a volatile substance. So if it is getting evaporated, then the polymer will be having lack of monomer to wet, so it will cause porosity. So in order to prevent that, covering with this rubber bowl or any container, so by which we are giving the saturated atmospheric air with the monomer, so it will not cause any voids in the surface of the special tray. So by this we have to fabricate the custom tray for the maxillary and mandibular arch. So once the special tray has been fabricated with the spin-on method, now I am going to attach the handle for this special tray. So what I have done, I have added some portion of monomer and polymer together and make it as a dough stage. Then during this consistency, like this dough stage consistency, I have taken a small amount of this and then I have adapted on the anterior portion of the special tray. So this width of this special tray should be width of the two central incisor, and it's about the height of the same central incisor, and the angulation should be about the 15 degree angulation, similar to that of the natural teeth, and the width of this be about 4 millimeter. So this handle has to merge with the tray and they should not influence the lip portion of the patient. So if it is protruding outwards, it will affect the lip portion and also the border molding of the upper maxillary ridge. And similarly for the lower anterior, for lower special tray, in the anterior portion you have to attach the handle. It has to be 90 degrees from the surface and it should not incline forward, so it will influence the border molding on the lower anterior region of the mandibular arch. So similarly it has to be 2 inch width and then the height of the central incisor and 4 mm in thickness.